Assalamualaikum and a very good morning. Welcome to the presentation of Therapeutic Landscape Quality and Satisfaction of Public Library. Introducing Dr. Haslinda binti Husaini, the team leader for this research. Group members was Dr. Siti Arpah Nordin and Dr. Shamila binti Muhammad Syuhidan. This study is to assessing the public library therapeutic landscape in Malaysia. Here with today, I'm presenting the result of the finding, the contribution and the benefit of the study. Therapeutics lead to the sense of non-treatment approaches used to help using the library's environment in the library, such as the built or natural, social environment, and spiritual environment. It is to calm the mental, physical, and spiritual aspect of the individual. It also helps to promote a healthy lifestyle. Example, during and after COVID-19 situation. Emerging practices are changing in the landscape of traditional therapies. The idea of therapeutic landscape used to show the relationship between place and improvement in mental health. In the context of a library, the purpose is to make sure that the quality of the library products, facilities, and the services is up to the expectation that the users perceive. The surrounding environment of an organization or institution may influence the customers' or users' therapeutic satisfaction, yet in a library settings, studies on the therapeutic landscape quality is still lacking. The incorporation of therapeutic landscape in the library, especially the environmental element, may enhance the library users' therapeutic satisfaction. With the therapeutic landscape dimension, library user satisfaction in terms of therapeutic elements may be measured. The research evaluates users' experience using three constructs, which includes the following elements: natural and built environments, social environment, and spiritual environment of the library. Further, the paper reported on the result of proposed research, thinking about library rules as the environment and not as a service provider. The assessment of perceived library therapeutic landscape quality may provide some insights on how users rate the library therapeutic landscape quality of public library. Thus, the findings can be used as a guide of library management to improve the crucial quality attributes and enhance the quality of the therapeutic landscape of the library. Libraries play a major role in society development as it is agreed the entertainment, education, information are overriding reason for library to exist. As the role of public library today has changed into a more visible and significant than the traditional roles, library therapeutic landscape helps to address emotional, behavioral, and social needs. The therapeutic landscape, first introduced in early the 1990s, have been widely employed in health and medical geography and gaining momentum in various health-related disciplines, consist of three main dimensional areas which, first, therapeutic landscape implementation at various places. Generally, therapeutic landscape models have been frequently studied by researchers in different backgrounds, specification, and dimension, and normally is tailored to fit the field it is being studied, especially in the medical field. However, among other common settings are home care nurses, national parks, children's summer camp, community garden, First Nation culture and health, care center, and public libraries. Williams, 1998, 1999, and 2000. Kearns and Barnett, 1999, Palka, 1999, Scarpasi, 1999, Turbo and Malinowski, 1999, Kears and Collin, 2000, Wilson, 2003, Milligans, 2004, Conradson, 2005, and Brewster, 2014. Library therapeutic landscape is deemed to be a relevant concept for library facilities, services, and collection, whereby it can be said as the essential tool for library development. In relation to this concept, the public library therapeutic landscape is helping the library in building an image as a calm space for leisure, suitable for the purpose of mental health service users. Library therapeutic landscape can be coined as the place that will providing facilities, services, and collection that is beneficial to their users' mental health. spaces that have a positive impact to improve people's physical, mental, and social, Gessler 1992 and Jung 2009. Original concept of therapeutic landscape was by the health geographical thinking. Association between the places and health helps to improve people from aspect of physical, mental, spiritual, and social, contribute to healing and well-being in places into the landscape. To support the development of society, to survive and to success in service performance. Quality is an assessment of customer satisfaction with the services method of evaluation of quality. This was the problem statement. First point is about misinterpretation of public library role. Library and librarian is only custodian of knowledge and information, no human capital element according to Krolak 2005. Library as essential element of community life and actively engage with community. Studies have shown that libraries have the ability to provide three main elements, namely services, facilities, and collection. It is the main prospect of library activities and businesses. Public library contribute free space for social meeting, community buildings, technological resources, connections and opportunity to the local economy, a sense of ownership of the community and high level of community trust, according to Kreisman and Rans 2005, Zakaria et al. 2011, and Abu and Audunson 2012. Point 2 is about the lack of awareness. Today living is in modern society, we are facing a competitive economic and social environment as well as demanding and changing lifestyle, which leads to stress and depression. People manage their stress in many ways, including exercise, find support, meditate, music relaxation, or find a peaceful space. Furthermore, public libraries have shown to help transform and improve the quality of people's life, according to Fitch and Warner 1999. According to Carnegie 2013, described the role of public library as key partners in helping to overcome social illness such as isolation, inequality, disadvantage, fractured communities, and ill health. Feel welcoming, enjoying the ambience and environment, gaining their knowledge through the programs and resources which indirectly plays an important part in the human development. Emerging practices are changing the landscape, traditional therapies. So these are the differences between research question and research objective. Overall, the research question is asking about what are the elements, what are the user expectation and perception, and what is the gap of between the expectation, and also what is the relationship between perceived library therapeutic landscape quality and the library therapeutic satisfaction. So the research objective is about to identify, to determine, and to examine, and also to identify and examine the relationship between library therapeutic landscape quality perceived and the library therapeutic satisfaction. This is the proposed to research framework. First of all, the study is to look on the expectation and perception between two samples. Library therapeutic landscape quality box is placed on the left-hand side. It indicates the element related to the library information resources and services. It clearly study are using paired sample tests to measure the significance. Library therapeutic landscape quality will be tested to see the library therapeutic satisfaction. At row 4, we look at the H1, H2, and H3. At row 5, to examine the relationship between them. So these are discussion of the findings. The first finding is about to identify the element of public library therapeutic landscape. In the model of therapeutic landscape, according to Gessler 1992, suggested three main dimensions, which are first, natural and built environment, second, social environment, third, spiritual environment. And however, in this study, researchers still remain the three basic elements and variable is just the aspect of library environment as per research done by Brewster 2014, literature review by Chen 2015, Montella 2015, Hussaini 2015, and Nordin 2014, 2015, and 2016, and based on the finding of interview and discussion with the informant. So these are the next discussion of the finding. Is about to determine expected library therapeutic landscape quality provided by the public library. The need to understand what library customers' expectation and perception in terms of library therapeutic landscape quality and satisfaction is now necessary to good management and development of society according to Brewster 2014. Public libraries must improve the quality not only in the service but also on library therapeutic landscapes quality in order to survive to success in service performance due to the focus of the public libraries as an institution and conducive environment to promote well-being, a space, restoration, and helping to promote holistic healing, according to Martin et al. 2005, Wood et al. 2013, and Brewster 2014. Finding number 5 is to examine the relationship between perceived library therapeutic landscape quality and library therapeutic satisfaction. From the analysis, the findings reveal that, followed by library social environment and library natural built environment, the holistic approach has been evolving and practices in the library services, facilities, and activities. There are also strong relationship between library therapeutic landscape quality and library therapeutic satisfaction, providing empirical evidence pertaining to the relationship of both construct in the context of Malaysia. The finding of this study validates the positive relationships. So, the diagram show the latest model of library therapeutic landscape quality. Based on the results, library natural built environment, library social environment, and library spiritual environment significantly predicted library therapeutic satisfaction. The model explained 29% variance change in library therapeutic satisfaction. The transformation of libraries in point 1 until point 5 be able to enhance quality of life, enrich individual learning, and enhance quality of life. Through the transformation of libraries enrich people live and guarantee better life. This is the copyright notice letter from Perbadanan Harta Intelek Malaysia. Its instrument and questionnaire design of library therapeutic landscape quality and satisfaction, model of library therapeutic landscape and quality and satisfaction, and also therapeutic landscape quality assessment tool, Malaysian public libraries. This study produced 3 major contributions for the communities, including the BI providers as well as researchers and practitioners in general. The instrument developed in the study can be either replicated in different research settings focusing on therapeutic landscape quality and the corresponding terminus. This study produced 3 major contributions for the communities. The instrument developed in the study can be either replicated in a different research setting focusing on therapeutic landscape quality and the corresponding terminus, supports customer-driven BI policies and strategies reconstruction, and inform decision to library training needs and competencies. The novelty and importance of the research is about rigorous study in the area of library science. It first introduced by Haslinda in 2015, study to benefit not only the user but also staff and library. It improves library information resources and facilities. It's about project management, budget planning for the library development.